Joel Nana is founding co-chair of the Global Forum on MSM and HIV. He is also the executive director of the African Men for Sexual Health and Rights, AMSHer, an African coalition of LGBT MSM-led organizations working to improve access to HIV services for gay men and other men who have sex with men, as well as the full realization of their human rights. Prior to AMSHer, Joel co-founded, and/or worked with several LGBT organizations in various African countries, including Nigeria, South Africa, and his native Cameroon. Joel holds an LLM in International and Human Rights Law from the University of Western Cape. Joel. He wants to hold the mic.
Hello. I had prepared my presentation starting with, ladies and gentlemen, His Excellency, the Executive Director of UNAIDS and the Director of the Global Fund, but they're not here anymore. So they've gone. So I will say, comrades, I salute you. I will start by thanking the Global Forum on MSM and HIV, the steering committee and the executive committee for affording me this honor to give a plenary speak. George and his team have asked me to talk about MSM activism, human rights, and HIV in Africa. And I'm going to do that to the best of my ability, based on my own experience. It is still recent, yet it seems so far. We came together, since we came together as a group to start discussing, sharing information and knowledge around men who have sex with men, same-sex sexuality, human rights, and HIV. And in 6 years of discussion around these issues at the International AIDS Conference, there have been tremendous change, and we've heard that today. And that change didn't only happen at the International AIDS Conference. It happens everywhere. It also happened in Africa. And for those who've been following the news, we've seen how it happened in Africa. I will just take a few examples. It is a momentum that took place, for example, in both positive and negative ways. In Nigeria, in Uganda, Rwanda, Senegal, and Malawi, and Egypt, for example, the growth of visibility and strength of the MSM movement, and more broadly the LGBT movement, has resulted in the increase in repression of same-sex practicing persons. In Tanzania, Kenya, Namibia, South Africa, Nigeria, and 10 other countries, in the contrary, there have been improvement in HIV policy. Men who have sex with men have been included in the respective national strategic plan for the fight against HIV. And in some countries, both processes have happened at the same time, meaning while men who have sex with men were being included in the national HIV policies, other men who have sex with men were being arrested at the same time. That's the example of, for example, Senegal and Malawi. The change has taken place at the regional level as well, and we've heard Michelle Sidibe talk today about the resolution that was adopted at the African Commission on Human and People's Rights. They adopted a resolution establishing a committee on the protection of the right of people living with HIV, most at-risk population, including, very clearly, men who have sex with men. And I'm happy to say that that work was thought of by part of AMSHer's board member, by one of AMSHer's board members, Steve Nemande. He pioneered that work, and he's with us here today. This is, for me, an immense step in the recognition, the protection, and the realization of MSM's rights to the highest attainable standard of health, as prescribed in various charters and to which most of our countries are part, including the African Charter on Human and People's Rights. But I want to step back a bit. the life of men who have sex with men, or most of us who are here, doesn't only revolve around health or the lack of health. There are other issues such as extortion, harassment, expulsions from schools, unlawful arrest and detention, disownment by families, and economic disenfranchisement that deserve equal attention. However, the disproportionate and unique manner in which HIV is affecting men who have sex with men on the continent, the lack of attention to these populations by national HIV interventions, and the impact of human rights violations on their capacity to seek and access HIV services has made it almost impossible to work on anything else. Even more so, as African LGBT organizations are increasingly turning into African LGBT organizations are increasingly turning into MSM service providing organization as the way to provide for those services since they're not being catered for. The struggle for the acknowledgement of the existence of same-sex practicing persons in Africa is still an emerging one. The movement really took off in the early 90s, but has been gaining in professionalism and sophistication over the past decade. There is a growing movement of superlative activists in Africa who tirelessly and selflessly work to address the human rights situation of men who have sex with men and their health needs. These activists, although they do not always articulate the complexity of male same-sex sexualities in Africa. However, several factors have impeded on their capacity to provide an effective and sustained response to HIV epidemic in communities of men who have sex with men. These impediments, and I'm going to name a few, vary from the understanding of homosexuality and homophobia in the African context and to the unavailability of adequate funding at grassroots level. For me, the argument that we always use when we try to, when we're doing advocacy, and this is both for LGBT activists and international activists, more so for international activists, however, is that homophobia is a Western import. And I have been thinking about that, and I think if we truly believe that homophobia is an irrational fear of homosexuality and homosexuals, and we also believe that as humans, as Africans, we can independently think, feel, express our thoughts and feelings, then there is no doubt that Africans are also capable of homophobia. Admitting, acknowledging, and attempting to understand this homegrown homophobia is a first step towards addressing the problem at the local level. Our mistake is to assume that homosexuality was imported, or that colonization has institutionalized homophobia. Although the laws and policies that criminalize and discriminate against same-sex practicing persons came from colonization, it is just one way to express homophobia. Well, another setback for the LGBT and the MSM movement in Africa is funding. The cumbersome funding applications and the forever changing climate of funding, as well as the funding priorities of funders and the lack of government funding scheme for MSM work at country level, has been one of the major obstacles to the growth and interventions of the MSM movement on the continent. For example, we have seen some funders who have spent considerable amount of monies on meetings which we thought was of no importance to the movement when most groups can barely raise $10,000 for their activities.